Hello, everyone. Welcome to Wellness Wednesday. I am Jamie Neal, certified nurse midwife and advanced practice registered nurse here at Lifetree Women Care. And I'd like to welcome you again to our Wellness Wednesday talk. Today, we're talking about miscarriages. Unfortunately, 10 to 15% of all pregnancies end in miscarriage. And unfortunately, we are not able to give a reason many times for the miscarriage. Sometimes these things, unfortunately, just happen. And although they happen, I do want to acknowledge that miscarriage is a loss. It is a loss of a pregnancy, and anyone who experiences a loss has the right to grieve. And that grieving process can vary from woman to woman or person to person. The husband or boyfriend of a woman who's suffered a miscarriage is experiencing loss. And so women and family members and friends of women who experience miscarriages should take the time or be afforded the time to grieve their loss and be able to cope with it in order to be healthy and to be able to move on. Let me talk about, for briefly, the warning signs of a miscarriage. If you are pregnant and you begin to experience some spotting or vaginal bleeding and cramping, especially when it's happening together, that could mean that you may be beginning to experience a miscarriage. Sometimes in early pregnancy, we can have some spotting or cramping just due to our uterus stretching and things like that. But if it continues and doesn't stop, then you could be experiencing a miscarriage, and you should contact your medical provider as soon as you start experiencing these symptoms. Warning signs to seek further medical attention or immediate medical attention, such as going to the emergency room or dialing 911, would be severe bleeding and severe pain, especially if you're having so much bleeding that you're becoming dizzy or fainting, very fatigued and weak. These are things that you need to address right away. You should go to the emergency room or call 911 if you're alone and need help right away. Another thing I would like to include in this conversation is, when do you try again, or when do you try to conceive again? And the truth is, if you're in the first trimester and you experience a pregnancy loss, you can try again right away if you like. But I like to encourage my patients or anyone that I know that's had a miscarriage to try to wait for a menstrual cycle to come, because if you wait for your menstrual cycle, that'll help with the dating when you do conceive the next time. There are a lot of miscarriages and a lot of pregnancy loss that go on, and those women need support. If you are a woman who's experienced a miscarriage or a loss of pregnancy of any kind, and you would like support, we're going to drop down in the comment section a link for you to follow with a phone number so that you can call to have someone to talk to. And until the next time, my friends, anything you would like to talk about, you can always send us a message or drop it in the comments so that we can talk about it on Wellness Wednesday next week. Thanks again for joining us, and I'd like to see you again soon. Take care, my friends. Bye.